What if I told you Benadryl has been linked to dementia? Many parents don't think twice about giving their kids Benadryl. New research has shown that long-term Benadryl use has been linked to some cognitive issues and dementia. My name is Dr. Sheila Kilbane. I'm an integrative pediatrician here in Charlotte, North Carolina, and this is my collaborator.
Hi, I'm Deb Allen, and I am an integrative pediatric pharmacist.
And we help parents get to the root of children's health issues using the best of conventional and integrative medicine. And if you're new to our YouTube channel, sign up below, subscribe below, share it with anyone you think might be helped by this information. You can join our email list and be sure to get all of our videos and emails as soon as they come out, and you won't miss anything. What we're going to talk about in this video is that link between Benadryl and dementia. What do parents need to know? Do we need to be worried about it? What are the risks? When is it safe to use Benadryl in kids? We have gotten so many calls and emails over the last several weeks because of this newer research that has come out. And I'm going to share my screen. This is just an article from Harvard, kind of linking this. It's called an anticholinergic drug like Benadryl, which linked to increased dementia risk. So that was January 9th of 2025. And what we're going to talk about, Benadryl is an older, it's called a first generation antihistamine. And when we label drugs and as they're developed, we name them second generation, third generation as the technology improves. So what Benadryl is pretty powerful, right? It works well if your child is having an anaphylactic issue, if they've eaten a food or been exposed to something and they're having a strong reaction. We absolutely want to give Benadryl. And if you need to, right, use your EpiPen, things like that. But we want to be careful when we're using it over the long term. And the difference, I asked Deb to come on so she could explain from a pharmacist standpoint the difference between these first generation and second generation antihistamines, because the second generation antihistamines do not carry that same risk of dementia.
Right, that's correct. So when a drug is developed, these older generation medications may get the job done. However, they may not be as selective and specific in addressing the problem. And that's the case when we're talking about the older generation antihistamines, such as the diphenhydramine, commonly seen as branded as Benadryl or in other over-the-counter preparations. So these older antihistamines are going to be less selective and they're also going to cross the blood-brain barrier. So you're going to see a more significant impact on the nervous system. So that's why you have the drowsiness when you take a Benadryl, why it may cause some dizziness. And so over time, though, we do know that it also blocks not only histamine, but some other chemicals in the body, most notably, as cited in the study, the chemical acetylcholine, which is very important to our brain health and functioning. So when we look at the trend with the first generation antihistamines, they also don't last as long. So they are good for this really short term, get the allergic reaction under control, and then transition if needed to a newer generation, such as the loratadine, Claritin, or your Zyrtex, which allow for a once daily dosing, and they do not cross the blood-brain barrier, meaning they're not going to cause the sedation or drowsiness that the first generation, the diphenhydramine, might. And it also allows people to have a much more consistent dose. So if we are trying to control histamine, we're not getting the side effects of drowsiness, and we're not having to dose it 3 times a day for it to be effective. We only have to dose these newer generations once or in the case of Allegra, possibly twice a day.
What I wanted to point out, Deb, before you go on, is that with the Benadryls blocking acetylcholine, it's over time. In this study, it was over time, and it was old. The study was done in older population, not in pediatrics, and it was people who had taken it for 3 years consistently. It starts to decrease the acetylcholine, that neurotransmitter in our brain that we need for thinking and paying attention. So we can use Benadryl for short periods of time, targeted as needed, and the kids should be fine. And the way that we work in our practice, we absolutely, because we use the best of conventional and integrative medicine, is we definitely use antihistamines when needed. But we also use we use vitamin C, we use quercetin, stinging nettle, bromelain, we use magnesium, probiotics that are going to help to clear the histamine. But the thing that happens is some people start using, kids and adults, Benadryl to sleep. People who don't even have allergies. Histamine not only acts as an excitatory neurotransmitter, not only acts, to create runny nose and watery itchy eyes, but it also acts as an excitatory neurotransmitter. So that's why that Benadryl feels so good, because it's calming the nervous system.
Without long-term risks.
Right. And so this is just the depictor, right? It's the acetylcholine going down over time. So use it in a targeted way as needed. Some of the other symptoms that you can see as a side effect, like I don't take Benadryl. I've maybe taken it twice in my life, and it's sort of that dizziness, sleepiness, foggy brain.
Over time, it hits many systems because we're talking about an important neurotransmitter in our brain and in our function, cognitive function. So it's interesting that this medication, it's always, there's everything in moderation and for as short of duration as needed, because we really have to look at these pathways, and if they're blocked long term, what is the downstream effect? So I think this is a kind of a lesson in learning moderation and not blocking a pathway or diminishing a pathway over time.
So difficulty breathing, right? If your acetylcholine is going down, these are some of the issues you can see: blurred vision, increased sensitivity to light, muscle twitches, cramping, urination difficulties, more frequent or urgent urination. And so and again, this study was done in the older population. So that's the good news, is we just want to be careful with the kids. And when it comes to our practice, because we're looking at natural ways to support histamine and to support sleep, we have this allergy bundle that we use that is a probiotic. It's a systemic enzyme, and then it's our Histasich, which is we call it our natural antihistamine, but that just means it stabilizes mast cells. It's quercetin, stinging nettle, vitamin C, and it comes in chewable, it comes in capsules. And
the great part about this is all of those components and products work together to control histamine in different areas of the body. So it's unburdening from a systemic level. And then who knows what the body can do and move above and beyond that.
And here's our allergy supplement guide. We always provide dosing, always have to talk. We're not giving medical advice, but this is what we use in our practice with our patients. And we have dosing cards by age. Our supplements, we have developed our supplements based on the ingredients so that they can be used for any age. And when it comes to sleep, magnesium is important for sleep. It also helps to clear histamine. Over 300 enzymes in our body require magnesium in order for them to work properly. So we always, if kids are having trouble sleeping or adults, we want to use magnesium and as one of the synergistic components to allergy management.
Mhm.
So I hope this helps. And again, just to recap, Benadryl has been linked in some research, long-term use of Benadryl to dementia. The studies were not done in kids, but we should be able to control allergy symptoms with kids without using Benadryl long-term by using some of the newer antihistamines and then using some supportive supplements. And nutrition is always a big part of that. Grab a copy of my book, Healthy Kids, Happy Moms, 7 Steps to Heal and Improve Common Childhood Illnesses. And it's on Audible, and we have a lot of information on our website, and all of these things we talked about are linked below. Thanks so much. Thank you, Deb.
Check back with us soon. We'll have more topics to come.
Subscribe to our YouTube channel and share it with your friends. Thanks.